Bismillahirrahmanirrahim. Welcome back, friends. Today in this video we are going to talk about the D-dimer blood test. So my name is Muhammad Kamal Khan and you guys watching Kami Microbiologist channel. Let's start the video. Now in this video, what are the main content that we are going to see? First of all, we have to talk about the D-dimer, that what is actually the D-dimer, what are the function of the D-dimer, and what is the D-dimer test means. Then we are going to see the purpose, means if there is some diseases you want to find out, so you have to perform the D-dimer test. So for what purposes the doctor recommend D-dimer test, what are the importance or uses of the D-dimer test. So we are going to see it in the purposes. Then we are going to see the requirements, means the material which we need to perform the D-dimer test. So we have to talk about this as well. Then we are going to see that how to perform this test, okay, and then we are going to see the result of this test, the normal range of the D-dimer, that how much it will be present in our body. So we are going to see the normal range as well. And the another most important point is to see the main causes of the high value of the D-dimer. Okay, so what are the main reason or condition due to which their value get high. So we are going to see each and everything in step-by-step slide. So first of all, let's start the video from the introduction, that what is actually the D-dimer test means. So remember guys, it is again the blood test, or we can say hematology test. Now why it is hematology test? Because we mostly perform it from the blood, the first thing. And the second thing is that we have to perform this test from the plasma portion. Okay, mostly for this test we take the blood in and collect it into the sodium citrate tube, and then we take out the plasma and then we perform the test. So it is actually the blood test in which we mostly check the D-dimer protein. And D-dimer protein, what is actually the D-dimer protein? It is actually a small fragment of the small fragment proteins which is especially important to degrade the clot. Okay, to degrade the clot, or we can say that it is also the fibrin degradation product as well. And when, let's suppose, if there is a blood clot happen, so what happen? Due to the presence of D-dimer, it will degrade the clot by a process which we call that fibrinolysis. Okay, so what we get a point that D-dimer is normally not present. If it is present, so it will disturb the clot formation. In a normal case, let's suppose if there is internal bleeding, if there is some damages, and let's suppose the vessel are get ruptured, so what happened? The bleeding will start. And normally what happened, due to this way the damages tissue will secrete some type of enzyme, and due to this way it will activate the platelets and some other clotting factors as well. Due to this way a clot will be formed. So when the clot will form, so further blood loss will be prevented. This is the normal process. Okay, and let's suppose if the D-dimer is present, so it will not make the blood clot, so it actually prevented the blood clot. So this is the abnormality. So in this test we mostly see the level of the D-dimer. So this is a little bit introduction related to the D-dimer test. Then we have the purposes of the D-dimer test, why we perform this test, why the doctor recommend this test. So remember guys, this test is specially important to find out different types of the diseases in our body. Let's suppose if you have deep venous thrombosis or pulmonary embolism, so then you have to perform this test. So it means that it is especially important to find out the deep venous thrombosis. DVT means deep venous thrombosis or pulmonary embolism. Deep venous thrombosis is actually a condition, or it is actually a disease in which there is a clot at the deep portion of your body, mostly at the leg portion or at the pelvic portion. Pulmonary embolism means the clot formation in the vessel of the lungs portion. Then we have it is also important to find out the hypercoagulability. What does it mean? It means high amount of the coagulation in the body. Then it is also important, or the uses of this test is to find out the DIC and stroke in the body. DIC means disseminated intravascular coagulation. What does it mean? It means it is again a condition or a disease in which the clotting will occur at different part of our body. Okay, and stroke is actually the brain attack, we can say like that. So using this test we can find out each of the condition or diseases. Now let's see the normal range. Normally, as we talk, it is not present, but let's suppose if it is present, so its normal range will be 0.4 microgram per ml, less than, okay, not more than, or not equal to this. And if we convert this, if we talked about in nanogram, so it will be less than to 250 nanogram per ml. Okay, so this is the means in nanogram. Now let's see the requirement, how to means let's suppose if we want to perform this test, so what we required. So remember guys, for the requirement we need a pipette and tips. Let me show. These are the pipettes and these are the tips, blue yellow tips. Pipette, we also call it adjuster as well. We need a kit of D-dimer. So this is the kit of D-dimer. We have two companies kit available. We have two company of the D-dimer kit available. One we called it Excel and the second we called it Fine Care. There are some other companies as well, but these two are one of the famous, so that's why it is mostly used. Another things that we mostly require, that is the BioCare or Fine Care analyzer, which we call it fluorescence amino chromatography. So this is actually a machine in which we mostly run this test. Let me show the machine. So this is actually the machine, okay, immunofluorescence machine. This is actually the analyzer. Now this analyzer mostly come with this incubator. So this is the incubator in which we mostly insert our strip. One thing more that I must tell you, if you unbox this Fine Care kit, so what you will found, first of all you will found literature that will contain the detail about the test, that how to perform the test, what is actually D-dimer, each and everything you will check in the literature. It contains this chip in which there is a software installed in this chip. So you have to put this chip first of all in this, you have to insert it, and then you will install the software of the D-dimer in the machine. Then you will perform the test. It also contains this buffer, as you can see, and strips. Okay, so this is, if you unbox this kit of the D-dimer, so you found this material. You also need the blood in agitated tube, which we already talked to. Okay, and you will have to take the plasma. How you will take out the plasma? You will centrifuge it, and at almost 5000 rpm for 2 to 5 minutes, and after that you will get the plasma, and from the plasma you will mostly perform the test. Now how to perform this test? First of all, what will you do? As we already talked, that first of all you have to install the D-dimer software using the chip in the machine. Now you install it, then what will you do? Now one thing that I must tell you, that here I write 20 microliter, but it depend upon on the kit. Let's suppose if you are using Excel company kit, so you will use 20 microliter, and let's suppose if you are using Fine Care company kit, so you will use 10 microliter. So remember the quantity. Okay, now let's suppose I'm using Excel company kit, so what will I do? First of all, I have to take 20 microliter of the blood plasma, and I will mix it into the buffer, which, let me show. Now you will mix it in the buffer. Okay, once you will mix it for 10 seconds, then what will you do? You have to take out 80 microliter. If you are using Fine Care machine, Fine Care kit, so you will take 75 microliter. So once you take the 75 microliter, so you will put it into this well, and what will you do? You have to wait, means you will put this strip, let me show. You will put this strip into the channel of this incubator, which mostly come with this machine. So you will insert it and wait for 15 minutes, almost 15 minutes. Now after 15 minutes, what will you do? You will take out it, and then you will insert the strip into this machine. So you will, once you insert it, so there some option will come, and here will be the start option as well. You will press it, and after a few minutes it will give you the report. So you will take printout of the report, and then what will you do? You have to make the report as well. So this is how to perform that test as well. Now let's see the main causes. Means there are some diseases in which the value get high, means the D-dimer value get high. So what are in which condition or in which diseases their value will be get high? So remember again, in this case we have deep vein thrombosis, means DVT. In this case the value are also get high. In case of pulmonary embolism, in case of disseminated intravascular coagulation, renal and liver failure. Now liver is most important things, and it is also important to make the D-dimer, and it can also break down the different types of the molecule as well. So due to the presence of D-dimer, it may cause the failure of the liver, and due to this way the D-dimer value are also get high, or if there is high value of D-dimer, so it will causes the liver failure as well. It will also cause the failure of renal, means the kidney, because if it is present a high amount in the blood, so it will be passes from the kidney, and due to this way blood, all of you better know that blood is also passing from the kidney. So if let's suppose if in the blood there is D-dimer and the blood is passing from the kidney, so it may cause the failure of the kidney, or damages of the kidney as well, which we call as renal failure. In case of the dengue, which is viral infection, and in case of malignancy, which is actually a cancer. So in these two conditions the value of the D-dimer are also get high. So this is all about the D-dimer, their purposes, introduction, requirement, procedure, and main causes. So I hope you guys understand about it. So if you like this video, so please make sure to hit the like button, share this video. If you have any kind of question in your mind, you can write your question through a comment. Inshallah, I will try my best to give you answer as soon as possible. And also subscribe my channel and press the bell icon to get more interesting video related to microbiology, MLT, each and everything. Thank you so much for watching.